Dapagliflozin, a sodium glucose cotransporter 2, SGLT2, inhibitor, has been shown to improve outcomes for patients with acute heart failure. In this video, I will discuss the mechanism of action of dapagliflozin, the evidence supporting its use in acute heart failure, and the potential risks and benefits of this medication. In the realm of cardiovascular health, the quest for innovative treatments continually evolves. One such advancement lies in the utilization of SGLT2 inhibitors, with dapagliflozin at the forefront. Recent research suggests that initiating dapagliflozin treatment before hospital discharge for acute heart failure could be a game changer. Not only does it appear to be safe, but it also demonstrates promising benefits, ranging from improved diuresis and natriuresis to reduced diuretic doses. Additionally, it streamlines the initiation of guideline-directed therapy, potentially transforming the landscape of acute heart failure care. Historically, the management of acute heart failure primarily revolved around the administration of intravenous diuretics and other conventional treatments. However, the emergence of SGLT2 inhibitors like dapagliflozin has added a new dimension to this approach. Dr. Zachary Cox, a distinguished figure in the field of pharmacy, presented compelling findings at the 2023 Congress of the European Society of Cardiology regarding the early initiation of dapagliflozin therapy for heart failure patients. One of the foremost concerns in adopting new treatments is ensuring patient safety. The study conducted by Dr. Cox and his team provides encouraging evidence that the initiation of dapagliflozin treatment during the first day of hospitalization for acute heart failure is not only safe but highly beneficial. This approach optimizes the use of a key medication, potentially reshaping the standard of care for heart failure patients. The effectiveness of dapagliflozin in promoting fluid removal cannot be overstated. The study's findings reveal that dapagliflozin positively impacted the totality of diuretic measures. In practical terms, this means improved diuresis and natriuresis. Patients experienced better fluid management, a crucial aspect of heart failure care. Intravenous diuretics have long been a cornerstone of heart failure treatment, but their use comes with potential downsides, including electrolyte imbalances and kidney dysfunction. Dapagliflozin's introduction allowed for a significant reduction in the administered doses of intravenous diuretics. This reduction not only addresses safety concerns but also enhances the overall patient experience during hospitalization. Another noteworthy outcome of dapagliflozin therapy initiation was a shortened length of hospital stay. As hospitals grapple with patient capacity and resource allocation, any intervention that can safely expedite discharge is of paramount importance. Despite the growing body of evidence supporting the benefits of SGLT2 inhibitors like dapagliflozin, hesitancy persists within the medical community regarding the initiation of such treatments during hospitalization. Physicians often express reservations about changing a patient's medication regimen on the first day of admission. However, Dr. Cox's research findings should catalyze change. The results of this study strongly advocate for a shift in practice. Physicians are encouraged to embark on a new approach, initiating treatment with an SGLT2 inhibitor early during hospitalization and maintaining it as a chronic therapy. By doing so, healthcare providers can optimize patient outcomes while adhering to the latest guidelines for heart failure management. Guidelines and recommendations from professional societies have underscored the importance of initiating SGLT2 inhibitor therapy during acute heart failure hospitalization. However, real-world application has been hindered by hesitation among healthcare practitioners. The study's findings provide a compelling case for bridging this gap between evidence-based guidelines and clinical practice. In essence, the key message from Dr. Cox's study is crystal clear: start guideline-directed medical therapy early. The benefits are multifaceted, including improved fluid management, reduced diuretic dosages, shorter hospital stays, and most importantly, enhanced patient care. The evidence is compelling, and the implications for heart failure treatment are profound. Dr. Wiviet acknowledges that while the initiation of SGLT2 inhibitors during acute heart failure hospitalization has received strong endorsement in recent guidelines, the supporting evidence has been limited. The study's results provide essential validation for the use of these agents in improving decongestion and expediting hospital discharge without compromising safety. Type 2 diabetes mellitus, T2DM, and heart failure, HF, are two prevalent chronic conditions that significantly affect individuals' health and well-being on a global scale. Both diseases have their unique challenges, but what makes them particularly concerning is their interconnectedness. T2 German marks is a recognized risk factor for the development of HF, and vice versa. When these conditions coexist, the prognosis becomes considerably grimmer. T2 German marks and HF share a complex, bidirectional relationship. People with T2 German marks are at a higher risk of developing HF, primarily due to the detrimental effects of prolonged hyperglycemia on the cardiovascular system. Conversely, HF can lead to insulin resistance and glucose intolerance, contributing to the progression of T2DM. This intricate interplay between the two conditions underscores the importance of managing them comprehensively. One of the key concepts in understanding the connection between T2DM and HF is diabetic cardiomyopathy. This term refers to the structural and functional changes that occur in the heart as a result of diabetes, independent of other cardiovascular risk factors like hypertension or coronary artery disease. Diabetic cardiomyopathy contributes to the increased risk of HF in individuals with T2 German marks and represents a critical target for intervention. Traditionally, T2 German marks and HF have been managed separately, each with its distinct therapeutic approach. However, recent developments in cardiovascular medicine have ushered in a paradigm shift. Sodium glucose cotransporter 2 inhibitors, SGLT2I, originally designed to lower blood glucose levels in T2 German marks, have emerged as game changers in the management of both diseases. Multiple cardiovascular outcome trials have demonstrated the effectiveness of SGLT2I in reducing HF hospitalization and improving cardiovascular outcomes in patients with T2DM. These trials have not only challenged the conventional treatment paradigm but have also highlighted the potential benefits of a unified approach to managing T2DM and HF. To fully grasp the impact of SGLT2 inhibitors on T2DM and HF, it's essential to delve into the underlying pathophysiological mechanisms. These medications primarily work by inhibiting glucose reabsorption in the renal tubules, leading to increased urinary glucose excretion. However, their benefits extend beyond glucose control. SGLT2 inhibitors have demonstrated favorable effects on the heart, including improved cardiac function and reduced myocardial injury. These benefits are thought to result from their ability to optimize cardiac energetics, reduce oxidative stress, and mitigate inflammation. While randomized controlled studies have provided valuable insights into the cardiovascular benefits of SGLT2 inhibitors, real-world data offer a different perspective. Analyzing the actual clinical impact of these medications in routine patient care settings is crucial. The management of both T2DM and HF is undergoing a remarkable transformation. The interconnectedness of these conditions necessitates a unified approach, and SGLT2 inhibitors are at the forefront of this shift. These medications not only provide glucose control but also offer substantial cardiovascular benefits. As we continue to explore the intricate relationship between T2DM and HF and the mechanisms through which SGLT2 inhibitors exert their effects, the future of cardiovascular care looks promising. By addressing both conditions comprehensively, healthcare providers can enhance patient outcomes and quality of life.